I'm Jana Tarjift. I'm a family nurse practitioner that focuses on the functional medicine approach. And I would like to talk about thyroid health in particular. Lots of people who know me, they know how passionate I am about thyroid health and how much the little gland means for our health and well-being. I would start from TSH. So if you're a little bit familiar with thyroid labs, TSH stands for the thyroid stimulating hormone. It's not thyroid hormone per se, it's a hormone that stimulates your thyroid to make thyroid hormone. TSH is made in your pituitary gland, and it's sent to the thyroid to stimulate it. So basically, it's kind of like a thermostat. If you were to live in Michigan, in the environment, which is thyroid constitutes the environment of your body, the environment is getting cold, your thermostat, this thyroid stimulating hormone, starts kicking in and cranking up, yelling at your thyroid gland to make more and more thyroid hormone, because the pituitary gland kind of feels it's kind of cold here. You know, the hypothyroid symptoms are cold hands, cold feet, and a lot of other symptoms that coincide with coldness in your body. So basically, TSH tells your thyroid to make more hormones so your body can function optimally. TSH increases, so the normal range usually is 1 to 2 in very healthy people, and it can go up to 3, 4, 5, 6, 7, and it could be even in hundreds. Personally, my TSH was in 4.5 range for a long time while I was trying to do nutritional therapies, vitamins and nutrients to increase my thyroid hormone, but my TSH wouldn't change. At the same time, at some point, my TSH went up to 200s. So if I were living somewhere in 100 years from now or 200 years from now, I probably would have died from being so hypothyroid that my brain was screaming at my thyroid gland to make more thyroid hormone. So what happens? Your thyroid gland makes T4 and T3. Those are total hormones. Those total hormones have to be converted into free T4, and free T4 has to be converted into free T3. The deficiency of free T3 can happen due to a number of factors. It could be nutrient and vitamin deficiencies. It could be toxins in your body. It could be the poor conversion of T4 to free T3, which could be caused by liver dysfunction, fatty liver disease, hepatitis C, hepatitis B. So the causes of thyroid dysfunction are numerous, and I could be having 15 people in 15 different rooms at the same time and all having hypothyroid labs and symptoms, but each person will have most likely a different cause that caused them to become hypothyroid. So we also check for reverse T3. Why reverse T3 is important? Well, it shows us if you have any resistance, thyroid resistance. So what happens if your reverse T3 goes into range of 15 or higher, even though it's still within the lab normal range, you may experience all the above mentioned symptoms of hypothyroidism, like constipation, hair loss, fatigue, brain fog, and joint pain, joint muscle aches, weight gain, or anorexia. Different people have different symptoms, anxiety, insomnia. All those symptoms get worse. So in the presence of the reverse T3 that's too high and the free T3 that's too low, you can have thyroid resistance. So what does it mean? Well, it's basically, imagine you have a lazy brother-in-law who comes into your house and gets into your armchair and drinks your beer. When you come to your house after a long day of work, you cannot get into that armchair because he's already there. So that's the way that reverse T3 acts. It's like a brake of thyroid. It sits on your thyroid receptors in the cell and doesn't let free T3 to get into the cell and do its work. So basically, that's why it's important to check the free T3 to reverse T3 ratio and see where you are. If you're in 20% or higher, most likely you are fine. and your thyroid is working properly. But if you have less than 20% ratio of reverse T3, free T3 to reverse T3, then probably you need to figure out how to decrease the reverse T3. And there are a lot of causes for reverse T3 to go up too. And we also check for antibodies, so antibodies to thyroid. So in the presence of hypothyroidism, it's important to see if you have antibodies in the blood or not. So we check for TPOs and anti-thyroglobulin antibodies. At the same time, 25% or even higher of Hashimoto patients don't have positive antibodies in their blood. Sometimes nodules show up during the ultrasound, thyroid ultrasound, so I would recommend anyone who has some kind of hypothyroidism just to have a baseline thyroid ultrasound to make sure everything else is fine and the gland looks fine. Let's face it, during the physical exam, if the nodule in the thyroid is tiny, there's no way for me to feel it. But ultrasound is non-invasive and it can pick up and tell me and the patient if there is anything that needs to be watched over the time, or it can be left alone and just watch every 10 years. So I guess that's it about the thyroid health right now. Let me know if you have any questions.